Today we're going to talk about the absolute #1 best meal to prevent heart attacks and a stroke. There's something very unique about heart attacks and strokes. 80 to 90% of heart attacks are clots. Now, you might think like this plaque that builds up. No, most of heart attacks come from clots. And 87 to 91% of strokes also come from clots. And the meal we're going to talk about today really has to do with preventing these clots. And this information today is based on the works from Professor Douglas Kell. Genius, okay? I will put a link down below referencing some of his information, but he stumbled on something very fascinating relating to dormant microbes. And a lot of these dormant microbes are actually pathogenic, okay? They create disease, but they're asleep and they're waiting for an opportunity to come back alive. I mean, even in the winter, for example, you have all these microbes in the soil that become frozen, but they're going into this dormant mode or a spore mode, and they're waiting until the season to change where they can come out and thrive. So this is what you need to know. Normally, when a clot forms, whether you cut yourself on your finger or something happens internally, you have certain things that come in there, certain proteins that form a clot. And then right after that, once it heals, it dissolves. Sometimes within minutes, sometimes hours, sometimes a little bit longer. This is a normal clotting process. If we didn't have this survival mechanism, we would bleed to death. However, in certain circumstances, especially with heart attacks and strokes, we have a different type of clotting that occurs. Now we have dense, matted strings of spaghetti that get hardened that are very difficult to dissolve. What you need to know is when we're dealing with most heart attacks and most strokes, we're not talking about a normal clot. We're talking about a different type of clotting where this normal clotting process changes over into something that is very dysfunctional. What causes this normal clotting process to turn over into this dysfunctional clotting process? The first thing in the perfect storm is a leak from either in your gums, in your mouth, or in your gut. If you have a certain type of pathogen that breaks down part of its outer shell, okay, or they call it the outer wall, that's called an endotoxin, okay, endotoxin. And all it takes is the tiniest amount of this endotoxin from this pathogen to cause this conversion from a normal clot to an abnormal clot. Even when they do an evaluation with calcium in your arteries, they might find soft plaquing. In that plaquing, they find many times this endotoxin, which again, it's just a little tiny piece of a pathogen. We also have excessive iron. What you need to know about iron is that your body has all these mechanisms to tightly control iron, because if there's too much iron, your pathogens will just thrive like crazy. Whereas we need oxygen to live, pathogens live on iron. And so there's this battle between the good bacteria and the bad bacteria fighting for iron. And if there's too much free iron, that can feed this endotoxin and amplify it. In fact, that free iron can actually wake up these dormant microbes and create more clotting. And this is why people that have certain genetic problems with too much iron, they're at risk for heart attacks and strokes and inflammation. You need to be cautious about taking too much iron, especially as you age and you're more at risk for this problem, and especially if you have endotoxins. So where does this extra iron come from? Well, a lot of times it comes from fortified foods. They fortify cereal, bread, pasta with this iron, okay? Now, you also have iron from your food, like in red meats. That's the iron that our body can really use to go into the blood cell and our muscle tissue. Also, from the supplements that people take, I would never recommend someone taking a supplement with iron, even if they're anemic. Instead, I would probably have them take a heme type of iron from either red meat or from liver, something like that, but not the type of iron that's in most of the supplements, especially the one-a-days. I also do not recommend that you cook in iron skillets. As a side note, when you drink alcohol, that also increases more iron in our bodies. So you have to be careful with that as well. Now let's talk about the stress. When you go through stress, you increase adrenaline. Adrenaline takes this to the next level. This will really supercharge or 10x the amplification of these pathogens in relationship to being able to consume more iron. Because if you think about it, adrenaline is a stress, and stress shuts down your own immune system and allows these microbes to actually be out of balance and start to grow more. And this is why even if you take a steroid, which is kind of a synthetic version of cortisol, which is another stress hormone, that can really take your immune system and just completely turn it off. This is why when someone goes through stress, the risk of dying from a heart attack goes up sometimes up to 2,000%, especially after severe stress or grief from the loss of a loved one. Now, I do want to mention a couple other things about this leaky gum and leaky gut situation. We need to know what causes this leak in the first place. Now, with your gut, it could be gluten. That's the protein that we can't really digest too well in certain grains. Alcohol, smoking, seed oils are very corrosive and they create like a rusting effect on our tissues. Ultra-processed foods, refined sugars, refined starches actually feed these microbes, especially the pathogens. NSAIDs, that's for pain, that can actually destroy the lining of the tissues, and especially antibiotics. Now let's talk about the perfect anti-clotting meal to prevent all of this. You know, when you think about it, most people think if we're talking about a meal to prevent a heart attack or a stroke, they're immediately going to think, oh, we have to go low cholesterol. We need to consume less saturated fats, right? That is definitely not what I recommend, and that is based on some past outdated information that is completely untrue. And if you have any attention on this cholesterol connection to heart attacks, I put a link down below of a video that will really help you sort that out. So now let's get into the perfect anti-clotting meal. The first thing I'm going to talk about is the protein for this meal. We want a protein that doesn't have necessarily excessive amounts of iron. And out of all the protein that would be the best for that, it would be the wild-caught salmon. Now you can do other fatty fish, but wild-caught salmon is one of the proteins with lower iron, but it's also the highest in omega-3 fatty acids, which is really good for preventing clotting because it thins the blood, it reduces inflammation in the arteries. And salmon does have some iron, but it definitely doesn't compare to red meat. So let's pair the salmon with a very specific type of salad that involves arugula. Arugula is very unique because it has the most nitric oxide. Now, I didn't talk about nitric oxide in the first section of this video, but I want to let you know that nitric oxide is a super powerful anti-clotting compound. And this will also help if you have high blood pressure. And the second thing that has the most nitric oxide is beets. So if we add the beet to the arugula, we have a very powerful anti-clotting salad. Now, let's not stop there. Let's add some extra virgin olive oil, which has really key polyphenols, which bind with iron and help to lower iron, okay? Not to mention polyphenols are very anti-inflammatory, and plus extra virgin olive oil will help to decrease blood pressure if you have it. Then if we add some apple cider vinegar to that, we can tighten any type of leakiness in our tissues, especially if it's in the colon. So apple cider vinegar can help do that. Now, if we add some garlic to that salad, or maybe even put it over the salmon, now we're really in business of supporting the cardiovascular system because we're going to thin the blood. We're going to add polyphenols to also bind with that extra iron if you have any. And garlic also is a powerful anti-pathogenic remedy. So that'll help with any microbes that are in your body that shouldn't be there. Okay, so this is the salad that goes with the salmon, okay? If we add a little sauerkraut, just a little bit, maybe like 1/4 of a cup, then we're going to add lactic acid bacteria, which actually binds with these endotoxins and helps neutralize them. Now, there's other ways to get lactic acid. You can do a little kombucha tea. You can add the juice from pickles, for example. So sauerkraut is not the only way to get lactic acid. But let's not stop there. Let's add some more polyphenols to bind with the excess iron, because the free iron is really at the core of this clotting problem. So if we added either green tea or black tea, we can bind up some of that iron. If we also add a little dark chocolate at the end, now you can either get the 85% or 90% dark chocolate and add that to the meal, just a little bit, which can actually bind this iron because it's loaded with polyphenols. But also dark chocolate is loaded with magnesium, which will also help the arteries and the heart, because heart problems are really related to too much calcium and not enough magnesium. Magnesium is one of the best things for atrial fibrillation and also to help lower blood pressure. You can even take this dark chocolate powder and put it in your coffee in the morning. That's what I do. Just a little bit, dissolve it up and drink that down for the polyphenols. After you've eaten the meal, okay, go for a 10-minute or a 20-minute post-meal walk while you breathe through your nose. Nasal breathing increases nitric oxide and actually enhances the oxygen, and exercise itself can help dissolve clots. Not to mention help your blood sugars be balanced better, not to mention increase more oxygen into the body. And so the combination of this meal with this exercise is going to greatly reduce your risk of both heart attacks and strokes. All right, now that you understand a little bit more about clots, the next most important thing to really learn about is the powerful effects of magnesium on the cardiovascular system. And for that information, I put this video up right here. Check it out.